From the Toronto Star, I'm Adrian Chung, and this matters. Four months into the school year, classes are still in session. So is COVID spreading inside schools. Educators, parents, and kids are just all trying to do their best in a really difficult situation. And there are reasons to be hopeful. Vaccinations for kids aged 5 to 11 are ramping up with thousands of jabs in the coming weeks. Here's Dr. Supriya Sharma, Chief Medical Advisor of Health Canada.
The department has determined that the benefits of the vaccine outweigh the potential risks.
And vaccination rates among teaching staff in many Ontario schools are high. The Toronto District School Board has a vaccine mandate for all its staff who come into contact with students. Yet, there's been a huge uptick in COVID outbreaks at Ontario schools over the last month. More than 160 outbreaks are ongoing right now, which is 3 times more than what we saw back in October. Joining This Matters, our colleague Kenyon Wallace, investigative reporter for the Toronto Star. Kenyon's been tracking and reporting on the numbers and many different school situations across the province for the last several months. He joins us to talk about why there's a COVID surge in schools and whether vaccines are the key in bringing it back down. Kenyon, always great to have you here. Thanks for joining us.
Thank you, Adrian. Great to be here.
I wanted to bring us back for just a moment to the start of the school year. Back in September, there was a lot of uncertainty about how COVID would play out with kids going back, but the consensus from the infectious disease doctors was that transmission of some kind would happen, especially among younger kids who weren't vaccinated at the time. We didn't know how bad it would get. We don't know if they would be serious cases, but we knew that spread would naturally happen. Now we have the data, though, right? So what do we know, Kenyon, about spread in schools right now?
Okay, well, what we know is when school returned after the summer break, there was about a week or two of sort of calm seas. And then in elementary schools in particular, where the students are unvaccinated, that is where we saw most of the growth of outbreaks. They grew initially during the first sort of 3 weeks of September, as high as, I think it was like 114, 115 outbreaks. And then it kind of settled down a little bit into the early part of October. Trends were looking good. And then in the last couple of weeks, unfortunately, what we've seen is since about sort of late October, we've seen outbreaks in elementary schools, again, really start to climb. They recently hit as high as they'd ever hit since the beginning of the school year. Now, interestingly, in secondary schools, we didn't see this at all. Cases there have remained relatively flat. And of course, children who are 12 years of age and older, which would include most secondary school students, are fully vaxxed. So there's, between 10 and 15 cases at any given time in secondary schools. So it's been smooth sailing for those 12 and older, but not so much when it comes to kids who are unvaccinated, the 5 to 11 age group.
And it's worth just setting the definition here. What officially counts as an outbreak in a school setting in Ontario? How do they count that?
Right. So an outbreak is when there are 2 cases in a school setting, for example, that are epidemiologically linked and were reasonably acquired at that school setting and have lasted a period of 14 days. So really, it has to be reasonable that the cases, or at least one of the cases, was caught at the school and then transmitted to another student at that school, and that those 2 cases are essentially the same strain of the virus.
Okay. So looking at the charts then, we can see that it was steadily increasing through October, again, mostly in elementary school kids. And then there's been a pretty big jump since the beginning of November. Do we know why that is? Is it flu season? Do we have any sense of why this has taken a pretty sharp turn since the beginning of the month?
Well, the experts that I've spoken to say it's likely a combination of different things. So the beginning of the year, you have kids coming back and they may have been traveling or they may have been hanging out with their families. And, you're going to have some transmission in that case. But remember that most schools, if not all, have been retrofitted. The government spent a lot of money to retrofit HEPA filters, or better filtration, better air filtration. And we still saw the continuation of the use of masks. We still are today. And it was relatively warm. So, kids were outside a lot. There were teachers who were, of course, trying to maintain the whole social distancing aspect. But then, of course, you get to kind of like the end of October, early November, and what happens? It starts to get colder, right? And so kids are inside longer and they're still unvaccinated, right? So maybe you're not going outside for recess as much. Maybe the use of masks has sort of slipped a little bit because, let's face it, 7 or 8 year old kids, it's really hard for them to, always remember to keep their masks up. I have kids and I'll tell you, it's tough getting them to remember to put it back up, So you might see some mask slipping. And with the colder weather and, this is respiratory virus season. So there's a few things that are happening now that weren't on the table back at the beginning of the school year. Now, of course, it's a good thing that our younger kids, ages 5 to 11, are now eligible to be vaccinated, but that hasn't happened yet, right? Only a few, maybe I think in Toronto, something like 70,000 doses have been given out so far. So, it's still a long way off before we start to see immunity in kids. So in the interim, you're going to see more spread in schools, unfortunately, among those who are unvaccinated.
Right. So it's a confluence of all the reasons that we know how this virus spreads. Again, maybe less ventilation, less mask use. Again, we're talking about a population that is still largely unvaccinated and almost sort of like the general population. We've seen an uptick in Toronto, in Ontario too, of cases generally. So maybe it's just also being mirrored in schools as well. So perhaps not a huge surprise there, but all of these factors are mixing in.
That's right. We know that in many cases, infections in schools mirror community infection rates. And like you say, when you close the windows and you crank up the heat and you've got a bunch of kids who are, packed into a classroom and maybe some of them aren't pulling up their masks properly, or they're playing together and, they can't social distance because of whatever reason. Maybe it's space. Maybe it's just the fact that it's, kids who are 6 and 7 years old are hard to control and, and they're unvaccinated and they're in these small rooms. You're going to get, if somebody comes in with a case of COVID, it's going to spread, right? And the other thing that I should mention is that right now we have basically vaccinated the entire population with the exception of 5 to 11 year olds. And where do 5 and 11 year olds spend most of their time? They spend it in school. So as one of the experts I talked to said, schools, elementary schoolers, are the only biome remaining really for a widespread outbreak of COVID-19. So it's not necessarily surprising that we're seeing it in these areas.
We'll be right back. You mentioned the vaccination for kids. Again, Health Canada has approved them. That's incredible news for every parent. I know of so many parents who were like, it's really happening. We might have a shot at a Christmas here. So is that the silver bullet? Is that the answer to containing spread going forward? I know we're not all there yet, but is vaccination the absolute key here?
It's definitely an extremely important prong of the solution. So doctors and epidemiologists that I've spoken to say it's not the silver bullet, as you say, but it's, of course, one of the most important aspects. Interestingly, one of the practices that most are saying must continue, and we have to have our guard up, we must make sure that we're doing it right, is masking, because that, in addition to the fact that we have kids who are not vaccinated, is really what's going to stop your aerosols or your exhalations from getting to others. So masking will be a huge key here to keep spread down, as well as vaccinations, and as well, like during the time that we wait for vaccinations. So just to give our listeners a bit of a timeline here, we know that when you get vaccinated as a child, so if you're a 5 to 11 year old and you get a vaccine, you have to wait 2 months before you get the next shot. And then you're not considered fully vaccinated until 14 days after that second shot. So what that means is basically if you got your shot now, if your kid got a shot, say now, late November, they're not going to actually be complete with their vaccine series until early February, right? And my kids aren't getting their shot for another couple of weeks, so they're not going to be fully vaccinated until, say, the end of February. So there's still a lot of time between now, right basically through cold season, there's going to still be huge numbers of kids who are not fully vaccinated. Now, I should say one more thing, and that is we do know that even just one shot of the COVID vaccine will be effective for helping to prevent transmission among children. It's not like you get one shot and you're still susceptible completely. That one shot will make a difference. But of course, you're not fully immune. The kids have not developed the full amount of antibodies that are needed to fully combat the virus. But one is obviously a lot better than others. So I wouldn't be surprised if we continue to see growth in outbreaks just because of the fact that we're rolling this stuff out in winter. But it's not like everyone's going to be vaccinated by Christmas and then we're home free. It's going to take several months. And then, of course, there's also people who aren't sure yet if they want their kids vaccinated, right? So maybe the rate of vaccination will not be as high as, say, the 12 to 18-year-olds. So these are all factors that could lead to a longer period where we see outbreaks in schools.
Right. So good news, but it's not flipping a switch. And as we have seen for the better part of 2 years, especially when it comes to case numbers and outbreaks, there's usually a lag time in how we see those numbers actually develop. It's usually a snapshot of, a week or 2 weeks ago. So this isn't simply, okay, once we get the vaccinations, then it'll plummet. We should still expect to see outbreaks and cases continuing to happen through the better part of the winter.
Exactly. And you're also going to see, with cold season or flu season, I should say, the symptoms of the flu and mild cases of COVID are very similar. So you might see, a lot of kids being kept home from school for whatever reason because parents are being cautious. Hopefully this whole rapid antigen testing that's being rolled out in schools will help to identify what are truly COVID cases. But it's a time of year where kids are going to be sick, and some of them, unfortunately, are going to have the flu and some are going to have COVID. So it's still going to be a bumpy road over the coming months. I think that's fair to say.
Well, I wanted to ask you that too. You spoke to infectious disease doctors in your reporting here. We know about ventilation, which may decrease a little bit, especially as it continues to get colder, right? We know about masking. Kids are starting to, hopefully over the next several weeks, continue to be vaccinated. Teachers in those settings are also getting vaccinated. But are we doing at least enough to understand where the outbreaks are happening or catching them fast enough? Is there anything else in our toolbox that we can be using to get a better sense of how this virus is moving through schools?
Well, so in an ideal world, a lot of the experts that I spoke to said, what we should be doing here is basically surveillance testing, where, every kid gets tested once at the beginning of a week and say maybe once in the middle of a week so that we kind of have an idea of where the virus is and how it's spreading through schools. Now, that may not be completely realistic given, the supply of rapid antigen tests that would be used. The province has come up with a plan to send every kid home over the Christmas break with 5 rapid tests, which they're asking parents to conduct basically over the Christmas holidays so that just before kids go back to school in January, you have an idea of whether your kid may have COVID. Now, an antigen test, a rapid antigen test, is not a diagnostic test. You would still need to get a PCR test to confirm that you have COVID. But this would give parents an idea of whether, let's say their kid's exhibiting cold symptoms. Is it COVID? I don't know. Let's check. This rapid antigen test would give you an idea of whether it is. So that will help, I think, to cut down on cases coming back after the Christmas break. And let's face it, we know a lot of people are going to get together for Christmas. It's been a hard couple of years here, with Christmas last year being canceled. I think it's fair to say a lot of people are going to say, well, we're having Christmas this year. Damn the torpedoes. We also have a system where if there are outbreaks in a certain area, the province will work with public health units to do testing in regions where we know there's increased COVID spread. But that happens, of course, once there's an increase in COVID spread in that area. It doesn't happen until that occurs. So we're kind of jumping on a problem when we see it, but it's kind of like we deal with it when it comes rather than keeping an eye on it, on everything to make sure that we can sort of see where cases are developing. So in an ideal world, surveillance testing would be great, but I don't know if we have the money or the supply of tests to do that. That would be definitely a tool that would be useful, but I don't know if that's realistic.
Yeah. And at least on the antigen test side of things, that wasn't happening in September, as far as I know it, at not preemptively sending tests to parents and to families before they returned back to school in September, at least.
That's right. So I should add, the province did come up with a test to stay program where if there is like an outbreak in a class or a school, those who are close contacts can do tests to, ensure that they're safe. And if they're fine, they can stay. So again, it's good that we have that, but it's not like we are constantly monitoring levels in schools. It's sort of when they happen in the community or when there's an outbreak in a classroom, then we kind of pay attention to it. So, I mean, that's a good tool to have. It's useful, but I know a lot of the experts have a pipe dream of, let's test kids all the time and really get a sense of where the virus is so that we kind of know where it's developing ahead of time.
Speaking of tools of how to track where and how these cases and outbreaks are happening, information on that isn't always easy to find for families. The Star has a tracking tool that you've helped lead on developing. Where can people find it and what kind of info will they get on this tool?
Sure, yeah. All you have to do is go to thestar.com, and then right underneath the logo, there's like a bar of topics that are popular, and one of them is schools and COVID. So if you click there, you'll be taken to a page that has sort of like a high-level, top-of-the-waves overview of recent cases in all schools, broken down by students, staff, as well as the number of schools that are closed and the number of recent cases in schools. And this is going back 2 weeks. There is a chart that we show that shows the entire school year starting in late August up till now that you can navigate on. And then below that, you can actually click through to another story, which says, are there COVID cases at your child's school? And there you can actually look up whatever the name of the school is that your child attends. And that will tell you what we know from the Ministry of Education. In some cases, the number you see may not be as of today because there can be a time lag, but it will give you an indication as to whether your kid's school has detected cases recently. And then, of course, parents who want sort of the up-to-date, by-the-minute information can always call their school board or public health unit. But yeah, we did this so that we could give people sort of a one-stop shop to find this information, because a lot of the information released by the province, thankfully, and I got to say, the province is pretty good about releasing data, better than they used to be. But a lot of the data is in, raw Excel spreadsheets, and they're not necessarily easy to read. So what we tried to do here is take that information and put it in a sort of a user-friendly format.
Kenyon, excellent reporting as always, and great talking to you about this.
You too, Adrian. Thanks a lot.
And that is Kenyon Wallace, investigative reporter for the Toronto Star. That's it for today. Thanks so much for listening. I'm your host, Adrian Chung. Our This Matters team is me, Adrian Chung, Brian Bradley, JP Fozo, Matt Hearn, Morgan Bachnick, Raju Mudar, Saba Aitazaz, and Sean Pattinen. Our music is by So Called, Mike DeAngelis, and Sean Pattinen. We want to hear what stories matter to you. Please send us your comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com/subscribingmatters. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.